When when I was a practicing physician, I began to think that there were many cases that were brought to the hospital that were largely preventable, and that the hospital is burdened with a lot of care for the people in need simply because the preventive aspect appears to be failing. And there is so much the hospital can accommodate. And I began to think that is there a way we can prevent some of these diseases, especially in the young population? So at that time, I was in Nigeria, and then I had a little bit of tools at my disposal to work with uh, what I needed to do. So I came to Finland, and then I've studied public health and epidemiology at master's level. And then I also um, undertook a program at Harvard University on clinical research. And then I also did a PhD in Portsmouth University in the UK. And so combining all of these things, I learned a lot of methodology in understanding how disease process occur and how we need to prevent it and timing that are important to prevent diseases, especially in the young population. And I also developed my own pathway whereby I can prevent diseases based on what, based on my formula, and I have different names for that. Yeah, so which is quite interesting and it's funny.
Okay, that's interesting. Based on your own formula, I think we will dive a bit deeper into this. But let's go back. Now, you started in Nigeria as a physician, so you did your bachelor's or your medical degree in Nigeria, and you came to Finland to do your master's. What prompted that journey to leave Nigeria to Finland and further on to Harvard, then back to the UK, and you're back again in Finland. So can you like draw us a roadmap? Why did you move first to do your master's in Finland, then proceeded to Harvard, then back again?
Well, you really uh, understand that it is only where the carcass is that the vulture gathers. You eventually find what you are looking for because some people appears to have it, and you go to where you can get it. So if you think that you stay where you are and everything will come to your doorstep or to your laps, you are joking.
Yeah,
You need to go and find it where it is.
yeah.
So interestingly, I think the year I came into Finland was when that was the year when free tuition stopped. So I was the last batch. So I was the door that closed. So I
Like,
stepped in, and as soon as I stepped in, the door was closed. But it was closed and then opening partially to for other people in different ways, maybe partial scholarship scheme or something like that. But I didn't need to pay anything. I need to just study. And at that time, you were given 4 years to complete a 2 year master program without anybody harassing you for tuition fee. But then you could play with the 4 years just because you want to get immigration settled and things like that. It's okay. But well, from the very beginning, because I came to look for a tool, I was not playing around. I began to work hard so much that within a year, 1.5 years, I was able to complete the essence of the master's program. And within the period of that 1.5 years, I even commenced a PhD. Why? Because I was looking for tools. So, and because I was looking for tools, immigration and things about immigration were secondary to me.
mm.
And because I know that if I get the tool, the world will provide accommodation for me.
I, I love that. I love the way you really, you keep it down to the very little, the focus. And I appreciate something about your pedigree because it shows that you are really devoted to making a change. Uh, and you said it very well. Like a Nigerian, you would always explore where you could find access to resources, and that's something that is much appreciated as an immigrant from Nigeria with a Nigerian background. It's something that we've seen that it tells well of us. We explore these opportunities and we seek to open doors in many places. And you've done right in that way. And I like the way you put it, that you kind of focused on getting the right tools. What role has education played in terms of you focusing on what is really essential? Because from what I hear now, you might be looking away from what everyone is pursuing to actually focus on yourself. Okay, what tool do I have? What resource can I get? What role has education played from the very on until now in you pursuing and achieving your vision and your dreams?
Education is a beautiful commodity. And next to life and next to water and let's say food and clothes, are the next you need to have is education. Because education provides a lot of answers to so many of the world's needs. Somebody is eating junks and he gets obese. It's simply because he's ignorant that food you think you like that is sweet is killing you. It's poison. But the day you have the education, you have the understanding and the enlightenment that this food is poisonous because it has these free radicals, it does this to your body system, then suddenly your taste bud in your own tongue begins to fight that. What happened? Education reconfigures your tongue. That is what it is. That is that regard. However, the fact that the world seeks to address the problem of inequity, inequalities, and yet some people don't have education, that problem cannot be solved because the Western world or the world of academic, excellence and everything thrives on education. That is what they have. So by the time you get it, then nobody thinks of your skin color. You sit on the same table, you are discussing the same thing. You write the book, I'll contribute as a co-author. I write my own, you contribute as a co-author. Why? Education leverages all of us on the same platform. Just as the grave equalizes every human being, education equalizes every human being. So in all you're getting, get education.
I like how you put it. Education is very important. I like how you tied the education part with knowing very basic things. You said it right. For example, we know some things we eat are not healthy for us, but hey, you keep doing it. But when you enlighten your mind, it tends to affect your perception, and you kind of do things. And it's really well said in that way. But what do you think is the solution? Because, for example, I know you've seen many cases with children, especially, and me as a parent, I worry about the physical well-being of my kids and how their life will play out. For example, you think about them always being on devices, them eating junks, and this kind of lifestyle. What do you think as a parent, as a society, can we be doing differently? And what do you say would be, based on your research, the implication of not doing anything?
So not do anything is very expensive. Doing something is very profitable. Profitable personally, profitable to the society. Then it's also budget saving ultimately. Now, think about it this way. If the majority of the working population of any country suddenly, let's say 80% of them suddenly applies for sick leave at the same time, that country will collapse in 1 week.
Mm-hmm. Mm-hmm.
And that sick leave is not because they all have chronic problem. Just one simple thing, maybe flu.
Mm-hmm.
Which means that our health is so important. We can't achieve anything when we are sick, when we create avenue for disease to just be our neighbor or our tenant. But there's something we can do. As it pertains to children, they are very vulnerable. They are dependent. That's how we see them economically, politically, in all ramifications. Children are to be helped. Children are to be protected. Children are to be guided by adults who were once children.
Mm.
Now, the problem is this. If an adult do not have better child, and then the child grow up to become exactly that kind of adult. So what does that imply? Our research, even amongst children, is tailored to giving parent understanding in changing their habits and their behavior and their lifestyle, because children learn by modeling. So if you as a parent, you're always on your phone, you don't need to say anything to your child. The child just picks that up as that is the norm. No matter how much you scream, the child in smile say, "What are you talking about?" But
Mm.
daddy, you are always here sitting down. 2 hours, you're on this phone. That means that is the normal thing to do.
Mm.
I need a display of something better so that I can change my own attitude. Action is much, much louder than our voice. So you talk of sedentariness. We have discovered that sedentariness is at the root of almost all disease condition. You call it obesity, insulin resistance, type 2 diabetes, high blood pressure, hypertension, cardiac damage, liver fat, excess liver fat, liver damage. Sedentariness is just at the root of everything. And then you see in every house, there is a large TV screen. Huh? So
Mm.
you move from your mobile phone that you are using on your cushion chair, on your sofa, to, to your TV.
Yeah.
Then you get up, you go to the office and sit down on your laptop. There's a problem.
Yes, it
And
is.
so if we need to take something away from this equation. If we don't do that, we set up a generation for disaster. So we need to lead by example.
I like the way you put it. And for our audience who don't understand this sedentary lifestyle, it just means not being involved in physical activity of any form, or just being what some would call a couch potato. You know, just there and kind of you consume the chips, the colas and things like that. That that they don't improve physical health, and overall it becomes like a metabolic problem for people, especially for young ones. And this gets me thinking, because I've heard recently, and this is, like we're having a discussion with a friend, and, they mentioned that even recently in the military, they're finding it challenging because young ones are not able to keep up physically with activities compared to years before. So, in fact, it's catching up already. And I like the way you put it, that we should show example, because if we are not showing example, they model what we are saying. But thinking about that now, what are some of the practical tips you would give to a parent who is struggling? Because we know how difficult it is to make time. We know how difficult economically it is, and these are some factors that actually play or contribute to a sedentary lifestyle. What are the basic steps that we can start taking to reverse engineer this process or the course of this path we are following?
Interestingly, solving problems of sedentariness is not highfalutin. You don't need to be in a gym club and looking for extra money to pay tickets to join a group that will be telling you to jump up and down.
Mm.
Simple things as taking a walk from your house to the store. Take your children with you. Let them push in the store that basket. It gets heavier as you keep on loading it with something. Huh? and
Yes.
they're feeling the intensity because they keep on pushing.
Yes.
By the time they are done, you realize that you spent 1 hour in the store, but it has been 1 hour of walking up and down. And you have given these children exercise for that day. You too, you have also participated in the exercise. Just cost effectively.
Mm.
And we have understood from our research that light physical activity of about 3 hours every day, imperceptibly, is the minimum dose to reverse the problem of sedentariness.
Mm.
And we can easily accumulate this thing. So these days, even for a 3 kilometer, you know, distance between a house and a school, a parent drives a child. When you can take a walk, it's just 15 minutes, 20
Yes.
minutes. Leave
Mm.
the house early. Finland, at least, Finland is safe. You leave the house early, you walk to school. The parent can walk a child to school no matter how old. You
Mm.
get interested in your child. Don't be too busy in this life because when they grow up, they will leave you alone if you didn't participate in their life. It is just the law of nature.
Yeah.
You reap what you sow.
Yes.
But if you wake up in the morning, you know your work is 8 o'clock, you dress up the child, you know that the distance between your house and the school, you say, my son or my daughter, we are taking a walk today. I just want to walk with you. Let's just talk. I tell
Like a bond.
you, yeah, exactly. So you have so many benefits by
Mm.
doing those things. But then you wake up so late, you just say, well, I will do everything within 10 minutes. You will really get it done within 10 minutes, but you have lost a lot. You have lost health, you have lost connection with the child, you've lost a lot of things.
Mm.
And if we can bring back, for example, you stay in a small city, you don't need a car, even in the winter. For example, January 5, I can't forget. January 5 this year, temperature in Skopje was minus 36 or minus 35. It was only Friday. I had an appointment in the university. I rode my bicycle. And while I was riding my bicycle, because I refused to buy a car, uh, because I know that if I buy a car, I'll become lazy. Even the shortest distance become hectic. And then you see people who came out of the car, just climbing a tiny hill, they'll be panting.
I feel you there.
They'll be panting. And you say,
Mm.
what are we doing?
Mm.
They'll be panting. What are we climbing? Do you get? But
Yeah.
I was riding my bicycle in minus 35. Even my bicycle dashboard, because it's an electric bike, and my bicycle dashboard gave this amber light. It is too cold. It is too
Okay.
cold. So I know it's really cold for the bike. But I was well dressed and I rode my bicycle about 15 minutes, 20 minutes, 30 minutes, a long distance. Well,
I,
that was minus 35. And I was sweating. Can you imagine that? The only thing is that you don't see any drop of water because at minus 35, your sweat is at the same level as the minus 35. So everything balances out. When you
that's it.
get to no sweat.
So not to worry that okay, I went for a hike and I'm not sweating, but actually you've accomplished something
Yeah.
by
Yeah.
doing that
Activity.
physical activity, and it's something that I really appreciate. So basically, a 3 hours light exercise is what you would recommend for
Yes.
anyone, and it doesn't mean like you have to go on like get on the treadmill and knock that out. No, but just a hike, and this is something I appreciate hiking a lot. And I try to get at least 1 hour a day of hike in whatever way, shape, or form. And like you also, I gave up my car for some time just because it's you see the need to kind of do, and my my place to the shop is about less than 300 meters. But in the past, I drove every single time I went to the shop. It was just like 5 minutes by walk, 5 minutes by drive or less.
Mm.
So this is something that you really put it in a way that we appreciate, and it's really concerning that we as parents, irrespective of how busy we are, don't make time to address this fact. And I really appreciate you going into this. But let's go a bit deeper into your work, into your research. You said you came up with a formula to take care of, illnesses, metabolic syndromes, insulin resistance. Can you shed more light on that? What is this method and how did you come about it?
So one of the interesting things that we have discovered is that when we look at children as they grow up, their body composition implies the content of their fat and the content of their muscle, and of course, other things like bone and blood may not really change per se. Bone may change, but blood is always more or less almost the same. So, what happens is that as they grow from childhood to young adulthood, those things change with time. Unfortunately, research have been conducted heavily in adults, and findings from adult studies are usually extrapolated, are usually, explained in such a manner that you can apply this to kids. But it's not true. A 45-year-old stays more or less the same even at the age of 70. Basically, there is no serious deviation from that because it's not growing again. The child is growing.
Yeah.
We discovered, because we use data from the UK, where the exact volume of fat mass and the exact measure of lean mass, or we call muscle mass, was taken as children were growing systematically until young adulthood. There's no place in the world where that data is available.
Mm.
And so children were followed up. More than 15,000 of them have been followed up since they were born in 1990. And they are still being followed up 30 years later. It's an extraordinary data set. It's called the
Mm.
Children of the 90s. So we have talked about obesity rising, rising prevalence of obesity across the globe. But the measurement we are using to identify obesity is problematic because we just grabbed it from the adult studies. It may work for adults effectively, but for children, their body composition is changing. When a child stands upon a weighing scale, what do you think you are measuring? You are measuring the muscle and not the fat.
Mm-hmm.
So when a child stands on a weighing scale, you say, oh, the child is 20 kg. What is 20 kg? Is it the child's muscle, the child's bone, or the child's fat? Essentially, in childhood, the ratio of their muscle to their fat is about 4:1. So children have 4 times more muscle mass than they have fat mass. When they grow into adolescence, it reduces to about 3.5, 3.4:1. When they grow into young adulthood, it reduces to about 2.5:1. That's about in their mid 20s. But that is life.
Mm.
Now, when a child stands on a weighing scale and has that ratio of 4:1, the child is simply heavy. If you calculate the child's BMI, you will say, oh, this child is obese because BMI says so, it has crossed a threshold. Or your
Mm.
weight to height has says so, it has crossed a threshold. And then you immediately begin to label that child as obese, brings a stigma, and the child begins to have that psychological negativity. The adversities are there, and then the child is rushed to having unnecessary intervention, trying to say, oh, don't eat this again, don't eat this again, then change your diet, then do this and do that. And what we are doing is unnecessary because the child is otherwise healthy.
Mm.
For example, some people will say that if wrestlers and boxers stands on a weighing scale, they don't have element of fat in their body. They are only muscular, but they will break every scale and we will say they are obese, right? They are
Mm-hmm.
not obese. They are very healthy, full of muscle everywhere. The same thing for children. But since we have always used BMI, BMI cannot tell what you are weighing. Body mass index will only tell you, okay, the person weighs this, and then you divide it by the height. So we don't know if it's fat mass, we don't know if it's muscle mass. And then children who are growing healthily, we rush them into intervention swiftly. We refer them to endocrinology clinic and things like that, and they start modifying their diet. There is a problem in that because there is a proportion of muscle mass a child needs to have to be able to fight diseases. When you drop that ratio, the child is now susceptible to diseases, even though you think that you are trying to stop obesity. Then you teach the child to sarcopenia. That's a problem. Why? Because the tool we are using is not correct. But a tool that can tell us about a child's fat is a measuring tape. All we just need is to tie it around the child's waist. Divide the measuring tape by the height of the child. As simple as that, you can tell that what you are measuring is fat mass. Now, when we published that study, we didn't see how important the society will see it until I got a phone call from the BBC. And they said, is this Andrew? I said, yes, I am. I said, who is on the line? I said, this is BBC. I said, I hope there's no problem. They said, no. They said, no, that they wanted to invite me for a live interview tonight if I'm available. I said, you are asking if I'm available? I am available because it may be an opportunity of a lifetime.
Yes.
Why? Just because of the tool, this tape rule, this measuring tape, to tell us more about obesity and redefine it is what is interesting to society. I never knew it would be that interesting, but that's where we are.
So that's the formula you discovered.
That's one of those. I have many.
I would want to hear more, and I'm sure we might probably not capture everything in this episode, but that's amazing. And that's something, when you think about very simple things, what works. It's a new knowledge that you've given now that, because so much emphasis is placed on this body mass index that you kind of deprive a growing child of the necessary nutrients. But you are saying that just with a tape measure and dividing that by the height of the child, you're perfectly gonna get if the child is healthy or not and should be kept on that path. So are you basically saying that if a child is looking overweight or big or have fat stored in his body, are you telling that in the very early on that the parent shouldn't worry so much about that situation? Or is this something that they should worry about?
Well, you can tell in a child by looking at a child how much volume of fat the child has in the body by looking at it.
Well,
your eyes has to be an X-ray machine. But there's nothing like that.
Yep.
So that is presumption. So what you need, if you feel like this child is heavy, looking big, go and find a measuring tape. When you find your measuring tape, we have proposed a cut point that should be adopted in Europe. And of course, I'm having a discussion with some people in different continents to also look at the numbers that can be attributable to excess fat. But generally, when you get to the point of, when you get to the threshold of 0.5, so when you divide your waist circumference by your height and you get a value of 0.5 and above, then you're at risk of high fat mass. When you get to 0.53 for males or 0.54 for females, because females naturally have more fat mass than males, then you are at a high risk of high fat mass, which is problematic. But these numbers, they look so tiny, 0.5. So half of your entire height should be your waist length, something like that. So waist divided by height, right? So that's 0.5. But I have observed that from childhood to young adulthood, in more than 7,000 children, your waist to height ratio does not change. It stays around 0.45, 0.44, 0.43, 0.45 throughout a 15-year growth period, which is very remarkable. And so you can do that and look at your child. A day is coming And I hope that the World Health Organization will adopt it and then it
Mm,
become a global issue and there'll be recommendations to use it. You don't diagnose a child with just a measuring scale. And I would say that you should replace your measuring scale with your measuring tape, right? So above zero point 0.5 is a problematic a threshold. But to get to that zero point 0.5 is a whole lot because the child must be that big, must
mm,
be so big that it's so obvious to a eyes. Not you
mm,
don't need an X-ray machine at this time. So must be that big. Otherwise, when a child is 0.49, it's okay. It's just a heavy child. Let the child play. Let the child eat.
mm,
We also need certain amount of fat in our body for all the cells to work. So it is not a goal to drain all your body of fat. You will die. You-
I like the way you put it. I like the way you kind of wrap it in. So the goal is a tape measure and the focus on less than 0.5. There
yes,
should be no worries. And
yes.
basically live a healthy lifestyle, which is, try to move as much as possible, keep the devices away as much as possible. And we are not going too deep into the addiction part of the devices. We are focusing more on the physical side that, okay, taking this away means that's replacing it with healthy values and healthy lifestyle. And that's something that is interesting. So can you tell us more about uh, because we would not go through other methods you've discovered. As you said, you've discovered other methods other than this, but I'm sure it's something that we'll be discussing in the future. Can you, the collaborations you've made, the attention you've gotten from your work, how has it helped you in a way, in a sense, connect to your personal journey so far? Because if you think about it, coming from Nigeria and the differences you encounter, what have you seen? Some of these collaborations, how has it played a part in shaping your story?
So, like I said earlier, that education leverages everybody. So, in other words, it is more or less a, a synergy, a symbiotic relationship. That is, you gain from me and I gain from you. There is no one Lord somewhere and one servant is waiting for the breadcrumbs from the table. Education cancels that
Mm,
because you will give people what they have never thought about. For example, I just came back from the UK where I was invited to give a lecture. When I finished talking for about 30 minutes, many people came to meet me, gray-headed men. I purposely looked at the people that were coming. 72 hours later, they were still coming. You know, they were telling me, why have I not thought about this thing? I have retired now. Huh? But I would think that you can provide answer to this. Can you please find a way to get this and add more information? I laugh.
oh yeah.
They were taking pictures with me. When I was taking my flight and I got to Amsterdam, a big man from Germany met me and then he said, I can't forget your presentation. So please come over next year to Germany and give us the same. It's so brilliant. You have something to offer. I've never talked about this.
Yeah.
That's education. These are great men. These are, and it's very interesting that when you come to a civilized society, what you see is that nobody is ashamed to acquire more knowledge. No matter the age,
Mm.
everybody stoops so low. Amongst in this profile of places where I go to give a talk, I'm always the smallest, I'm always the youngest. But at the end of the day,
You're the wisest.
so I don't know how to describe it.
Yeah.
And everybody is Caucasian, everybody is American, everybody is white. So do you get? So
Yeah.
it is about symbiosis. It's about You give what you have, and then you take what I have.
Yeah.
And by that, that's collaboration. So I can't really say that, well, I have come to gain something from this. Well, education is there for everybody. Apply yourself, get as much as you need. You can't have too much because after a while, you will fulfill the scripture that says, I have more understanding than my teachers. It is very true because that is my reality now.
I'm
I
sure.
now
No,
teach my teachers.
I'm sure you are able to teach some of your teachers at this point, and that is really lovely because it's always the expectation for you to know more than your teacher, and that means the teacher has done a very good job, and it's evident in your case. And I like how you tied it in to the fact that, and this is something that I wouldn't exit this conversation without going into. You are an immigrant from Nigerian background living in the West. And oftentimes in Finland, for example, the narrative surrounding immigration is often negative. It's presented in a bad way. And this is something that I have personally not believed to be true because we have a lot of immigrants doing exceptionally well, irrespective of the limited access to resources that they have. And you are remarkably one example that there exists to this fact. Like you are saying, you've been able to travel around the world, you've been giving lectures in most places. And I think that's something that should be highlighted, an immigrant story of success. How would you say, and I know you have probably different experience from immigration in generally in Finland as an immigrant, what are some of the challenges that you've seen? What are some of the benefits that you've gotten? And what recommendations would you make to the average immigrant who is struggling to find a place in society, irrespective of having the talent, the skill, and the education to make it happen? What would you give in that way?
Thank you for the question. So I will not answer directly as it relates to me, as I might be atypical, but I will answer on the basis of some of the experiences of my students and different people I've met in different places. One thing is that immigration is non-negotiable in the world we live in, and it's a fact.
Mm-hmm.
Everybody migrated from somewhere.
Mm.
Everybody.
Yep.
So, but and also there are different categories of migrants. I will speak on the behalf of migrants who are moving because of education, who are moving because they really want to do something with their life, not just moving because I need just to change my place so I can have access to money and live large. Well, that is a very myopic mentality
Yeah.
because poverty is bigger than a problem of lack of money.
Mm.
Poverty is a disease of ignorance. It's a deficiency of understanding. That's poverty. In mental health, there is something called poverty of thought. I was discussing with a professor we met in the air when I was flying from one country to another. And the question he asked me is that how do you get your ideas? I laughed. Because really, idea rules the world. The whole world is using one thing or the other. Somebody is becoming billionaire because of it. Just an idea. He just think like, why could everybody let us have a Facebook? Then he began. Today,
Yeah.
he's a billionaire. An idea. He employs so many people. His salary may be small, but he's laughing because the whole Facebook project is his idea.
Yep.
So he's richer than everyone.
Yes, yeah.
So he can wear tiny clothes without wearing a suit. Huh?
Yeah.
Because he's a rich man. His riches began in his mind. For a migrant moving into a new country, you must accumulate wealth first in your mind. The challenges will be there because the people you are moving to their place, either Finland or wherever country, are not expecting you. They don't even know you are existing.
Mm-hmm.
But when you come there, they all have their own background stories about wherever you are coming from as a result of what they watch on TV or what people push to them, what they see on newspaper. Those things you can't change. They will always be there.
Mm-hmm.
But when you come and you alight in this country and they begin to interact with you or your path begins to cross and they begin to see the wealth that is resident in your mind, they will personally delete what they've learned here about your country.
They start pressing delete, right?
I tell you, because they will realize that it is be foolishness for them to be describing what they think that they saw some time ago. And when they look at you, they can't relate.
Yeah.
So what do you need to do? Increase wealth in your mind. It's just a matter of time. The wealth in your mind will become a reality on ground. That is what it is. That is all what my education has given to me. I labored to ensure that my mind is wealthy. And so I can stand and say, because I say this, that is what it is.
Mm-hmm. Mm.
Either you are black, white, yellow, green, blue, it doesn't really matter. You can't change it. I
Yeah.
have said it.
I really like your analogy of the whole thing. It's a very good way to sum it up, and I really it hit home because when we maintain a healthy and a wealthy mind, it sums up our life basically. It's the reality we live, and it's nice that you are really representing in a good way, and this is something that I want to also tell to the audience, something that they should think about. Oftentimes we measure success by the amount of physical cash, by the properties and the things that you have around you, but from your example, you equate wealth to a healthy mind, to being acceptable, and to pursuing something that you love. And that is something that I really like, that takeaway, because the way you tied it into the idea analogy, idea rules the world, yes. Because, you sleeping and waking up and putting your ideas into action automatically means the difference between you getting to where you want to be and basically your achievement in life. So it's really something I appreciate how you've put it, and I also appreciate that we all have unique experiences as migrants. Some of us, we came here because of war. Some of us, we came here because of education. Some came here because of love. Some are also because of economic issues. Irrespective of what brought one here, the idea is to actually seek to maximize the things that you can get or make of your own reality. And that's something that I really appreciate. And I really appreciate also you showcasing or coming to tell us about your story, because it's something that everyone needs to see, both the immigrant, both the average local and internationally, of what we need to do, especially towards our children, because it's something that is very concerning. And anyone that has kids know how worried they are about their kids' future. And I think you've given us quite a lot in terms of how we can think about things differently, which is the title of this podcast, to think about it. So we have something to think about. The 0.5 meters, the changing from the body mass index to the normal basic tape. Ideas like this are something we want to be chewing on and be thinking about in the few days. But as we conclude now, which is, what would be your biggest giveaway in terms of, to anyone listening, pursuing whatever they are pursuing in their own field, or they have a dream that they want to pursue, and they have these limiting factors, challenges that are blocking them, what would be your giveaway to them?
The greatest wealth on earth is human being.
Mm.
And you are one of those.
Mm.
Which means nobody has the right to look down on you.
Mm.
Because if they look down on you, they've depreciated the collective wealth of the world.
Can I clap to that? Please go on. Please go on. That was a good one.
In that sense, you value yourself because you know you live for the world's collective wealth. And so when you face all of these challenges, for example, some of the papers that we try to publish were rejected 21 times over a space of 2 years. I didn't break down. I didn't have mental problem because I know that what I did was correct. The interesting thing is that after we published that paper, 2 of those big journals invited me to the editorial board. I'm an associate editor in one of them.
Okay.
Why?
Nice.
Because the wealth now speaks for itself. Yeah. The collective wealth of science realized that you can't really ignore this champion.
Mm.
You could have closed the door. You closed the door because you are the one that was ignorant. He's carrying a cargo that you have never seen before. And now I can deliver my cargo.
Oh, yeah? Because
I choose not to look down on myself. I am contributing to the collective wealth of science. So find your own space and recognize that you are part of the human capital the world has. And so when you have all of these challenges, they are there. Just like a pilot is not scared of turbulence. He still flies today. He will fly tomorrow. Turbulence yesterday, turbulence tomorrow, because maybe everybody's in the airport wanting to travel somewhere. He keeps on flying.
Yeah.
And of course, we know that the sky is so large that 2 birds cannot collide. What does that imply? Find your space. Let the world feel the essence of the wealth that you brought into this space. Don't depreciate it. And nobody knows the value of the wealth but yourself. And understand they will only price it on the basis of the price tag you place on yourself. Yeah. So if you consider yourself $1, everybody will start pricing you from $1. And by the time they want to buy you, you are now 0.3.
50 cents.
So what do? You start from 1 trillion.
Yeah.
Whosoever wants to play the bargain will first of all look at his pocket and say, am I worth it? Why? Because that is the price tag you place on yourself. And people will begin to measure up to that. And if they try to bargain, then you fall among the billions. Not just in monetary cash, but in understanding, in intelligence, in contribution to your society. So it could be in politics, it could be in finance, it could be in accounting, it could be in medical science, anything. Understand that you are part of the human capital in this globe that makes the world what it is. So value yourself. Don't let somebody else look at you because of your skin color. Have you ever seen somebody's eyes in any race at the back of his head? Is anybody's nose at the back of his skull? We all look the same direction. We all have 2 ears. When you go to the hospital and you are sick and you need blood, is it a green one they draw for you? It is still the same color.
Red, yeah.
It's red.
Yeah.
When they are giving you the blood, do you ask, is this from an African?
No.
That means you are not sick.
Or you're not ready to survive.
That is true.
So
really, that's what I say last.
I really appreciate the way you summed that up. And I'm a firm believer in just what you've said. When you create value for yourself, when you value yourself, it will show to others. So to our listeners, irrespective of your color, irrespective of the challenges, the background, place a value on yourself and try to offer that value to every other person. Because, rightly said, humanity is what we have. Without being human, we have nothing. Every other thing that we have in terms of properties, in terms of gains, it doesn't mean anything if we remove the human element. And that is something that I really appreciate from your part and from your saying this. I'm sure this conversation is going to go further than this. I wish we could have done this in person, because in that case, we would have, gotten the very core of it. But I'm sure we have a lot to take away from this, even though the audio quality might, from your side might go. So please bear with us, listeners. We had to do this through Zoom. And it's something that we are hoping to bring Professor Andrew Agbaje again on the Think About It with Osita FFC podcast. It's been really nice having you, and irrespective of all the challenges that we had, we still were able to create value somehow from this. And this is something I really appreciate your time and your energy towards this. And in summing up, any last word to the audience and to your listeners? And please, you can say more about yourself, where to find you, and in case someone wants to reach out to ask more questions. We are going to be adding the links to your pages, so it's a way to find you also. But please give us something to go away with.
Well, I will say that we need to fight for our kids. Kids today are adults tomorrow. We save economically when we are able to guarantee a healthy childhood, a healthy adolescence, and then a healthy young adulthood. But parents must live by example. You must practice what you preach. You don't smoke cigarettes and then tell the child not to smoke. How is that possible? So we need to modify our diet. If everything you are eating is red meat and red meat and red meat and starch and red meat and starch and red meat and starch, it's not good. You have to begin to compartmentalize your diet into bringing in vegetables and things like that. Your taste bud may not like it, but after a while, you will begin to enjoy it. Yes, there is always a problem that, well, when I move from one place to another, I need to go and look for the food of where I'm coming from.
Yes. Typical Nigerian, yeah?
Well, in one way or the other, it is okay, but it is dangerous. It's dangerous in the sense that where you are coming from has a very high level of stress. That even if you eat a big calabash of carbohydrate, your stress level will dissipate all the energy away. But now you come to a country where the stress level is very low and you are still eating that volume of carbohydrate. My friend, you are buying tickets to the hospital.
I'm sure you're living that for our African audience. that we like our fufu, our gari with the soup on a regular. And unfortunately, a lot of us we are struggling with it, and that is something that we need to give concerns to, because if we want to live a healthy life, we might probably need to start considering that. So let the fufu go. Oh, I've enjoyed doing this with you. Thank you so much for giving us the time, and we really hope to talk to you again in the coming future. So, audience, thank you for listening. And if you've gotten something from this episode, please reach out, give us a feedback, and try to engage with us so that we can find what better ways to bring you more interesting stories to think about. So, thank you so much, Professor Agbaje, for coming.
Thank you very much.
And until next week, when we meet again with the audience, thank you and stay strong. It was good. It turned out well. Let me take a brief listen to see. and the audio came out better when this mic worked better. So
that's great.
Oh, nice. I would work on this. And
that's
this
great.
actually, yes,